diet. We're under the care of a nutritionist to make sure that he is adequately supplemented. And due to dissatisfaction with our pediatrician and sort of the medical community in general, our nutritionist has pretty much become our primary care physician. I don't know if that's common with other parents of children on the spectrum, especially ones who have responded well to diet interventions. What would you recommend to a parent who was newly diagnosed for a primary care physician? As you said, there's not a lot of doctors in the medical community who are steeped in treatment of autism. I mean, what would an example be? A developmental pediatrician?
I have a quick thing, and then I'm going to let you say more. There's a book, I'm blanking on the exact title, something like Healthcare with Your Child with Autism Spectrum Disorder. And it's by two doctors. They're married. Their last name is Volkmar. You've probably heard of Fred Volkmar. His wife is a pediatrician. He's a child psychiatrist, and it's all about how to find a good pediatrician and how to find out whether or not your pediatrician is a good pediatrician for your particular child with autism. And you'll probably get a better answer.
I agree with getting that book because there are some certain things that when you interview a pediatrician, and you should, that book would have certain questions to ask, and based on the answers, then you'll get a feel for what's best. Also, talking to other parents of children on the spectrum in your support groups to see who in your geographical area that they've used, who's been good. The word of mouth is really helpful. And then the other thing, though, I would say is that I'm very glad that you do have a nutritionist, because I know I've talked to many physicians who actually work in the autism community, and they say that one of the things that they see a lot is when there is a child who's on an elimination diet, sometimes because of just getting the diet off of the internet, the things that have been eliminated haven't been replaced in another way to give the children nutrition, so the children really become ill and even worse off. So that's very good that you have a nutritionist helping you. But I would say that it will be very important to get a really good pediatrician to look at the general health, because one of the things that I always tell people is that you want a physician who realizes that autism is not protective against any of the typical things that happen to children, and as they transition to adulthood, things that happen to adults. So it's not protective against cancer. It's not protective against cardiovascular disease. It's not protective against pregnancy, and all this other kind of stuff. So you really, throughout the lifespan of your child, and as your child becomes an adult, throughout the whole lifespan, everybody should have a primary care doctor who doesn't blame everything on just maybe whatever they have. So like if a person has diabetes, and they suddenly start getting really bad headaches and they've never had them before, don't just say, oh, that's your diabetes acting up. You would work that up. Well, the same thing with a child or an adult with autism. You want a primary care doctor who really treats your loved one like a typical patient, and listens to either the person or the parent talking about what's happening. And so you really should interview the pediatricians to find out, but it will be important that everybody have a really good pediatrician, and then